This is our digital setup and we have a digital intraoral scan.
So imagine now if we have to place 6 implants on the top and 6 on the bottom, and if we have integrated our CBCT with the intraoral scan. We do not need to do a cut open surgery for placing 6 implants. It could be only punch hole.
The scanner tip has to move at a constant speed and it has to be kept at a distance of 3 to 5 mm from the.
So, doctor, can you share your experience with the CAD/CAM machine, especially for fabricating inlays, restoration, and
entire smile design?
Yes.
Absolutely, yes. So CAD and CAM, computer-aided designing and computer-aided milling. Yes, it is. It is absolutely going to change the way digital dentistry is going to be. So imagine now if we have to place 6 implants on the top and 6 on the bottom, and if we have integrated our CBCT with an intraoral scan. We do not need to do a cut open surgery for placing 6 implants. It could be only punch hole because we have already planned this with the surgeon, with the prosthodontist and the technician. So the patient who is walking in, 60-year-old, 70-year-old, 80-year-old, right, with not so happy smile, right, or the teeth that he or she doesn't like, we remove the teeth. We have already pre-planned looking at the CBCT using the CAD/CAM technology. We've already pre-planned the placement of the implant, and according to that, the prosthesis or the smile that's going to go in. So this is all kind of ready, and the whole idea of tooth in a day,
Yes.
right, is this. So the technology is going to change the way we are looking at dentists. So we are no more healers or pain relievers. We could be somebody who are actually believing in providing new and smiles and brightening up the day.
Also, I would like to add one point. So there are CAD/CAM milling machines in the clinics. So
Yes.
we know about the single visit root canal treatment.
Yes.
This is single visit root canal treatment with the crown on the same day.
Absolutely. And I, as a second generation dentist, I dream about a day where each dental clinic in India would have an in-house milling machine. Yes, cost is still a deterrent for a lot of us, but technology is there, right, to make a single unit crown, or even a double unit crown, but in a single visit. Absolutely. Having a chair-side milling machine is an asset to the clinic.
And that saves a lot of time, especially
Time, convenience, precision. So the patient walks in and walks out with a new crown.
So, doctor, you mentioned about your Smile 3D Design Center. So how is it going to be helpful for the fellow dentists?
Yes, so imagine even I have a practice which is now 7-8-year-old, but I don't want to have an in-house CBCT, and right now don't want to burden up with an intraoral scan. So the idea is to have that as a scanning unit, which will, and the option of designing and printing is an optional thing. For the doctors, they can pick and choose if they want to get it designed from us or from their own technicians. But that unit has a good Sirona CBCT, where we can take single arch, double arch. We can also take intraoral scans in the same center. So our facilities there are OPG, CBCT, intraoral scan. We will soon be adding extraoral scans also there, right? So once we have all that, we can send it to the doctor or the surgeon, whosoever is in need of that. In case if they want a reporting along with that, we have an option of that as well. And now, for example, if you are a dentist and you have sent the patient to Smile 3D, so now that, and there's a missing tooth, number 6. Now we have taken a CBCT of this arch, and we have also taken a intraoral scan of this arch. So we have an add-on service wherein we can provide you with a dental digital guide to place an implant. So yes, exactly, a template which will help us place the implant in a better way, define the direction of the crown in a better way. So I think altogether just aiding the dentist in and around in helping their digital journey go in a much more smoother way.
So, doctor, since so many equipments are involved and so many effort is involved, is there any package for dentists to enroll?
Yes, yeah, Prince, you've got it right there. So we do have few subscription plans, wherein it's like a gym subscription, right? So because we want to encourage the dentists in and around to use the facility more and more. So we are charging 4,000 rupees for 6 scans, 8,000 rupees for 10 scans, and 10,000 rupees for 20 scans. And you can pick and choose the scan. So I think any other details you could reach out to us for this.
Doctor, can you walk me through the process of digital impression from the beginning till the end?
Absolutely. So it is taken by a beautiful machine called as an intraoral scanner, right? And I think it is one of the state-of-art, equipments, because the precision with which the scan comes is really amazing. How the image is generated. Here I would like to call upon, we have our in-house prosthodontist, Dr. Neha Andhari. She's an MDS. She has done her undergrad with me from our same college. Her master's is from Goa, and she's been a part of our team for last few years, and she'll give us a quick demo of how an intraoral scan is taken and what are the benefits of it.
Today I'll be showing you the technique how to make a digital scan. This is our digital setup, and we have a digital intraoral scan. This is the scanner tip, which is autoclavable and it can be changed for every patient. We start with scanning the upper arch. The scanner tip has to move at a constant speed, and it has to be kept at a distance of 3 to 5 mm from the tooth surface. We start scanning the occlusal surface first. We run our scanner tip through the occlusal surface of teeth on one side. We move on to the front teeth, and then we come across the other side of the arch. Then the scanner tip goes buccally. We scan the buccal surface of the teeth, remembering that we have to move the scanner tip at a constant speed, and then we come to the palatal side of the upper arch. Again, we move from one side of the arch to other side of the arch, and we stop. After this, when you have to record the next arch, that is the lower, we can just press the button on the scanner and it moves on to the lower arch. Similarly, you have to scan the lower arch, remembering that you have to scan the occlusal surface first and then move around the entire occlusal surface and come to the lingual side first. Then run your scanner tip around the lingual surfaces of the teeth, and then you have to move on the buccal surfaces of the teeth. This is the way we can complete our upper and lower arch scan. After this, the next important step is to take a bite scan. So for the bite scan, you have to make sure that the teeth are well isolated and they are not wet. They should be completely dry. After that, you have to insert your scanner tip. Ask the patient to close your mouth completely, like how you chew. And then you have to record the bite on one side first. So when I start scanning this side, the jaws will articulate on its own on the screen. You can see that, and then you have to stop. Similarly, you have to come around the other side, open, close, and then you have to scan the other side of the patient's bite. That completes our bite scan. Few things to be remembered while scanning are that you have to retract the tongue and the cheek. That can be done with the help of our scanner tip. So you saw it is very easy and convenient to do the intraoral scanning, very comfortable for the patient. It eliminates the error that is caused by making a physical impression. When you take an impression with an impression material, there is some distortion that is happening, whereas a scanner will record a live image of the prepared tooth. So it is highly accurate way of making an impression. Also, some patients face gagging when the impression material is put in their mouth. That can be completely eliminated, and it is very helpful for such patients when you use a digital scanner to make an impression.
So thank you so much, Doctor, for sharing your valuable insights and your time with us.
Thank you, Prince, for making us a part of the Dental Treasure series, which are very popular, right? And I hope this helps all of you to start your little bit of, your journey towards the digital dentistry.
I hope this session was very informative and helpful. A big shout out to all our speakers who have shared their valuable inputs and time. If you like this content, I highly request you to like, share and subscribe this channel. This is Dr. Prince signing off. I'll catch you in the next episode. Thank you.